us live and those listening to the tape presentations afterwards. I'd also like to warmly welcome our expert panelists, which we will introduce to you very shortly. However, before we begin this, it is important to pause for a moment and state we will stand in solidarity with our colleagues and friends in the Ukraine, and we will do all we can at FIP to provide real and emotional support. The FIP webinar today is entitled Enabling Multiprofessional Vaccine Prescribing and Administration for Improved Uptake Rates. Please be advised that there will be simultaneous French translation available for those of you who wish to take advantage of the French translation. And this is a very important area for pharmacy practice and patient care. And this area is one of a great interest for me, and I'm extremely passionate about the pharmacist's role in vaccinations. The webinar is focused on the African region. My name is Ron Goose. I'm a pharmacist, a former regulator, and assistant professor coming to you live from Canada. I'm also the past chair of the Canadian Patient Safety Institute and the past co-chair of Healthcare Excellence Canada. I'm currently the consultant for the DOT Pharmacy program of the United States-based National Association of Boards of Pharmacy, and for the past 16 months have been chair of the Regulators Forum. In today's webinar, we will be having a panel discussion on vaccine prescribing and administration. We've assembled a panel consisting of pharmacists and policy leaders from the African region, and they will present their thoughts and participate in discussion on this timely issue. This is just not about the recent and still current pandemic, but really a broader picture of vaccinations. In many countries, vaccination coverage rates are suboptimal and are largely focused on childhood vaccinations. Critical goals to expand vaccination pathways include having more and more easily accessible vaccination points and more professionals who can deliver vaccinations to a greater number of people, and certainly open up the access to those living in remote and underserviced areas. However, equally important is the evidence-based advice and information on vaccines and vaccinations. This event will discuss the drivers and the barriers to interprofessional understanding, cooperation, and vaccination task sharing in the area within the African region. Additional information will also be provided regarding the regulatory authority and the oversight granted to different healthcare professionals to prescribe and/or administer vaccines within this region. We have a lot to talk about over the next 90 minutes, and I am only one of the moderators for the webinar today. Without further delay, I'd like to introduce my co-moderator. It is my pleasure to introduce to you Ms. Jocelyn Jahiba, the current Vice President of the African Pharmaceutical Forum and the Chairperson for the Retail Pharmacists Association. Jocelyn has worked in hospital and community pharmacy practice settings, but also teaches the pharmacy technician course at the Harare Polytechnic School and also mentors undergraduate pharmacy students. She's a council member of both the Health Professions Council and the Pharmacy Council of Zimbabwe, and was a board member of the Medicines Control Authority of Zimbabwe. Jocelyn presently chairs the Pharmacovigilance and Clinical Trial Committee and is currently on the FIP Council and editor-in-chief of the African Pharmaceutical Journal. In a few short minutes, I will welcome Jocelyn to take over the audio and introduce our excellent and expert panel for today's event. But first, I have some pertinent information to bring to your attention. Please note that this event will be recorded and live streamed on the FIP YouTube and will be available to on the FIP website using events.fip.org. Certificates of attendance will be issued by FIP to all those in attendance during the live program, but also available for those that view the program at a later date. To all those listening live, please feel free to send your questions to the Q&A box and Jocelyn and I will do our best to manage those questions and get answers to those questions from our panelists. You are most welcome to provide feedback on this webinar using webinars@fip.org. If you're not currently a member of FIP, please take a moment after the webinar to join. FIP membership has immense value. The membership benefits include an invaluable source and resource, networking, timely events, and of course, webinars. I can tell you from my personal experience, FIP membership has increased my knowledge and proven very useful in performance of my duties. And of course, FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. If you are a pharmacist or pharmaceutical scientist and you would like to become a member, please join through FIP's website at www.fip.org, and the link is on your screen as well. And we are most fortunate to have a sponsor for these regional forums. GSK Biologicals is the sponsor for these regional events. It is important to note GSK support comes as unrestricted funds. FIP has independently developed the program, selected and invited speakers, and developed the questionnaire. And this is the amazing panel that will work with you for the next 90 minutes. We've had some technical difficulties with some of our panelists joining, and Jocelyn will give you an update on that information, but I want to sincerely thank each and every one of them for taking the time to join us today. Jocelyn will be introducing the panelists right after I describe the program for today and remind everyone of the learning objectives. Well, the program is really straightforward. We introduce the panel and then get right into the roundtable and panel discussion. We will have time at the end of the presentations to go through the questions that you placed in the Q&A box. And then we'll have some closing comments when we finish and bid you farewell with the very best regards. Our learning objectives for today are to identify drivers and barriers related to the regulatory landscape of vaccinations in the region. Learn about the examples of best practices in terms of interprofessional cooperation and task sharing involving pharmacists in the area of vaccination. And finally, to explore the plans for switching from pandemic to an endemic response in the region, including the role of the pharmacist in vaccination and in patient care and treatment. Without further ado, Jocelyn, I'm looking forward for you to turn on your microphone and work us into the stage of introducing our expert panel. Thank you very much.
Thank you for the brilliant introduction. Some of the things I've gone through, some of I've moved on from some of those committees, but it's part of my pharmacy practice and history in terms of where I practice and so on. I feel greatly honored to be one of the moderators for this meeting. And to start off with our panelists, we've got a number of panelists from different African countries, and different countries have moved in different directions, and they've got different challenges, and they've come up with different solutions for this vaccination, which was necessitated by the advent of COVID-19. So my first presenter, one of our panelists rather, the first one is Mr. Samuel, or pharmacist Samuel Adekola. He's a pharmacist by profession, and he has been the chairman of the Community Pharmacists Association in Nigeria, which is ACPN, and doyen of the pharmacy trade in Nigeria. Pharma Adekola controls one of the country's biggest pharmaceutical companies. In many ways, Dr. Adekola has continued to make indelible contributions and marks as a national officer of his profession. Welcome to the panel, Dr. Adekola. Our next presenter is Mr. Potiphar Mwendera. He's my president of the Pharmaceutical Society of Zimbabwe, of which I am a member. Mr. Mwendera has a vast experience in community pharmacy practice. We've changed our name from retail to community pharmacy practice, and he has been there since 2002 to date. He has been a member of the Pharmaceutical Society since 2003 and is the current president of the Pharmaceutical Society of Zimbabwe. And in those years, he has gone through the ranks in terms of his practice as a pharmacist and as a member of the Pharmaceutical Society of Zimbabwe. He has put in a lot of his time to ensure the association grows. His special interests include community pharmacy practice, where he interfaces with the public, where health interfaces with the public. Welcome, Mr. Mwendera. Then the next presenter is Mr. Frank Nana, is the president of the National Council of Pharmacists in Cameroon. He was elected in January 2021 at the convention center during their conference, which was held in Yaoundé. We welcome you to this panel, and you can share your experiences with us in terms of vaccination. Welcome to this meeting. Thank you. Our next presenter, or our next panelist, is a pharmacist, Anath Niang. He is the president of the Order of Pharmacists in Senegal. I can't read French, but I think some of you understand what I'm talking about. It's Orders des Pharmaciens du Sénégal, which is the Order of Pharmacists in Senegal. Welcome to this presentation. The association brings together the Order of Doctors, Pharmacists, Dental Surgeons, and Veterinarians together. He is a health professional at the service of the health system of his country. Welcome to this panel. Our next panelist is Mr. Lucas Nyabero, or pharmacist Nyabero. He has got a doctorate from the University of Massachusetts and Health Sciences University in Worcester. After graduating, he worked as a clinical pharmacist at several Phoenix area hospitals, including Scottsdale Healthcare and Arizona Heart Hospital. Optimal wellness through precision or personalized medicine is his ultimate goal. This calls for a collection of accurate data that will be used to personalize care. His goal is to play the role in formulating accurate health algorithms and protects the data donors. Accurate algorithms will provide data for precision or personalized medicine, which will support preventive health care and ultimately optimal wellness. Welcome, Dr. Nyabero. Then we have our next presenter, is pharmacist Ezieni Onwekwe. I hope I pronounced that right. She's a vaccine program coordinator for the Africa CDC in Ethiopia. She's a trained pharmacist and a public health practitioner with years of experience in strengthening public health systems in Africa. She has seen the revamping to a state-of-wide drug revolution fund in Nigeria and contributed to various outbreak responses across Africa. She has managed numerous Africa CDC-led projects in the Southern African region. She is currently supporting the implementation of Africa CDC continental vaccine strategy in the area of vaccine acquisition, delivery, and manufacturing. Currently, she's the project manager and she manages professional services and serves as a mentor and facilitator for numerous youth empowerment initiatives. Welcome to this program, Dr. Onwekwe. Welcome. Our next presenter, or our other panelist, is Jamila Reese. She's the CEO of the Association of Pharmacists from the Portuguese-speaking countries. She's a public health professional with vast experience on medicine regulation, both from regulator and industry perspective. Earlier work was regulatory affairs for pharmaceutical industry in Portugal, including marketing authorization and pharmacovigilance procedures. I like this. Persistent and focused. She's persistent and focused on achieving the objectives, and she has the ability to work under pressure and to implement solutions which have led to the creation of Cabo Verde Drug Regulatory Authority under very challenging conditions. And it has achieved effective functioning regulatory authority, which is sustainable and is continuously improving. So sustainability and continuous improvement are part of the goals in the regulatory sector. She has the ability to communicate effectively with different stakeholders and has been able to coordinate specialist teams to produce and discuss structural legislation for food and pharmaceutical sectors, resulting in better regulation of the sectors which aim at public health and economic development. Pharmaceutical legislation published includes methodology for pricing, integrated systems for pharmaceutical marketing monitoring, good practices for manufacturing, distributing, and dispensing of medicines, market authorization of medicines, pharmacovigilance, and cosmetic regulations. Welcome to this panel, Dr. Reese. Welcome. Our next panelist is Ridion Swalami, who is a pharmacist specialized in health economics and holds a master's degree in health economics. He's the founder of the Association of Scientific des Etudiantes en Pharmacia d'Alger. ASEPA is the abbreviation, which is chairperson of external relations of Algerian Pharmacy Federation. And she's a founder of that association. He is the founding member of the association, FAP, and served as Secretary General of its first executive board. Welcome to the panel, Dr. Swalami. And finally, our final panelist is Imibobo William, who is a public health pharmacist currently engaged as project manager on US CDC-funded Global Health Security Project, where he provides technical support to the government of Nigeria on COVID-19 adverse events following immunization surveillance. He's highly skilled in designing systems for drug safety monitoring, continuous quality improvement, integrated disease surveillance and response, and health systems strengthening. He has a track record of responsibility, integrity, commitment to program objectives with a strong focus on improving system performance and patient outcomes. He aims at building systems that will help actualize the global health security agenda. Welcome, Mr. Williams, to this panel. Thank you. I want to welcome everyone to this panel. You can put on your videos so that we just have a meet you. But as we continue with the discussion, we'd actually appeal to our members to switch off their videos and their audio, their speakers, if they are not speaking. So I'm inviting the panelists to come to show to put on their videos. Welcome to all the members here present. And I just want to appreciate sparing your time to be part of this panel to discuss this very important issue. And the objectives have already been highlighted by my co-presenter, Mr. Goose. Thank you. Maybe just to start the ball rolling, it's probably like a favor. I'll start off with my president from the Pharmaceutical Society of Zimbabwe, Mr. Mwendera. We're looking, my first question is towards vaccination, because our issue is on vaccination coverage. Is there a need to improve vaccination coverage rates across all ages in your country or in the region at large?
Mr. Mwendera? Yes. Yeah. Thank you. Good afternoon, good morning, good afternoon, good evening to all the listeners and all the members who are joining us today. Yes, I think, yeah, it's there is real need to improve vaccination rates across all the age groups and across all the disease classes that are currently that bedeviling the world currently. And I think coming, I mean, in the middle of this COVID-19 pandemic, we have actually noted that access is greatly limited because of the channels where vaccination is accessed in our local setup, where it has to be accessed through the public health system, and this has left out quite a significant chunk of the population who are not serviced through this system.
Thank you, Mr. Mwendera. I can ask from Nigeria, the Nigerian perspective. You can share with us, Dr. Adeola.
Yeah, thank you very much, my Vice President, the coordinator. Yes, is there any need to improve vaccination coverage across all ages in my country, Nigeria? I would say capital yes, because as we speak, the level of coverage of healthcare, particularly when we talk about vaccination, I mean, narrow down to vaccination in Nigeria, where perhaps for the routine immunizations for such things like polio, which has some political implication. I think the country is doing fairly well. But even when you talk about other routine immunization or vaccination services, one could say that we are not having the best of it. Today, very many of our people live in the rural area where we don't have access to hospitals, particularly public hospitals, where majorities of the routine immunizations are carried out. In many of the places, many of citizens, the majority who lives in the rural area or suburban areas,
sorry, you are on mute. Oh, sorry, he's
okay.
Yeah, good job.
I think it's network. So it is very necessary to increase and expand or improve on vaccination coverage across Nigeria. I think it's a very good.
Thank you. Maybe we can hear from Frank Nana from Cameroon. What's going on there in terms of vaccine coverage? Frank Nana.
Hello.
Hello. Thank you, Dr. Adekola. Cameroon, I don't see is he there? Okay, sorry, I was asked from Cameroon, and we'll probably come back to them. From Amat Niang, from Senegal, how are you seeing the vaccination coverage in your country from being a pharmacist, and what is going on in your nation? In Senegal.
Yeah, he may have had a difficulty joining the meeting, Jocelyn, and perhaps can join us in progress.
Oh, all right. So let me ask you the next person within the group. I've got from CDC perspective. Esieni Onukwe, you can tell us what you, from that perspective, when it comes to vaccination coverage in Africa.
So there's something one of our colleagues said. I'm not going to talk about one country in particular, so it's going to be continental from a public health perspective as well. So there are some programs that are doing well, that are political, of course, like the polio programs, the yellow fever programs that are doing well. But then there are also some programs that aren't doing so well. And there are also some circumstances that makes it difficult for some of these programs not to do well, some because of the areas that are difficult to reach, the war-torn areas, so that are affecting coverage, making it difficult for coverage to get to these areas. And I'm going to talk about COVID because that's a lot of what I do now. And I don't know why everyone is shying away from talking about COVID, because that's what is happening now. So there's a very big need for us to improve our vaccination coverage rates across, I mean, the region, the countries. As it stands now, the COVID rates is about 13.5, and that's really ridiculous, really low for a continent that is aiming to get 70% by the end of the year. And that speaks to a lot of other diseases as well, given all the put behind COVID to get to that point. So data shows that there is really a need to get targets, you know, to push for more, to create more awareness, to do more stuff, to be more creative in our initiatives, in our risk communication and community engagement campaigns, so that we can actually improve vaccination rates, not just for COVID, but also for these other diseases that are low in coverage rates. Over.
Thank you very much. She gives us a perspective. I was just speaking from a number of countries there. We've had Zimbabwe, we've heard from, unfortunately from Cameroon, our apologies, probably having challenges with connection. And then in other countries, which I have missed today, you can open your, from the country perspectives before, yes.
So my name is Dr. Nyabero from Kenya, and yes. I want to give a different perspective, and the perspective I want to give is that a lot of times, if you look at the level of immunization among the kids, it's higher than the other groups after that. And I think partly because it's because of the training and the education that is given why something should be done or not. And I think the education of why immunizations are necessary, why immunizations are necessary, is a very important part towards achieving what we need to achieve. I'm a very strong believer in education. When people understand why they need to do something, they will be more willing to do it.
Thank you. Yeah, because that's the personalized vaccination and any programs for them to succeed. People have to appreciate what are the benefits. Thank you very much. And I think as pharmacists, wherever we are, if we are talking of vaccination coverage, we should be talking to the people so that they can go to the sites where this vaccination is carried out. Based on this thing, generally, I understand, my understanding now from the different countries is that vaccination for adults is not as widespread as we get it for children, because maybe of the political will and so on in our different countries. And we have to encourage people, especially now with COVID, which has come onto the, which is the new kid on the block, if I might call him. Someone was talking about, I've got Dr. Williams.
Yeah.
Excuse me, I wanted to add, sorry.
Yeah.
Okay.
Oh, I wanted to ask Dr. Williams to give him an opportunity to talk about this COVID vaccination and what you think about the coverage.
So yes, apparently, thank you so much for the opportunity. So apparently, I'm going to be speaking from the Nigerian perspective, right? The coverage for COVID vaccination is really low. It's really low, even lower than the coverage for the African region. Ezine just quoted 13% for the whole Africa region. I know for those that have been fully vaccinated, I mean by fully vaccinated, at least have taken 2 doses for the vaccines that are available, we have about 8.2% of the eligible population. So Nigeria's approach was to vaccinate at least 51.5% of the population, which was about 112 million people. But presently, we are staggering at around 9 million people that have, gotten the full dose of vaccine, which is about 8.2%. So the coverage is really low, and it's critical that at this point in time we are having this conversation, because the next steps would be, how do we ramp up? I thank God for what's going on in Nigeria at the moment, where the Association of Community Pharmacists have something going with the Primary Healthcare Board, and they are trying to optimize, they're trying to improve the uptake, improve the coverage rate, but it's really not it's really not going as it should be when compared to the Western countries. So just to add my voice to that, thank you.
Thank you very much. I think we've heard the perception of what is actually going on. I think I can go on to the next question, which is a follow-up to try and address this poor coverage of a vaccination generally in the African region. Who are the main providers of this vaccination, and where do people get their vaccination services in your countries? And within that same breath, we'll talk about how we can improve that. But where do we get these vaccinations? Who does the vaccination? The main providers. Maybe I'll start off with the Nigerian guys. From Nigeria, Dr. Imoibo, Dr. Williams.
Yeah, thank you so much, Pharmacist Williams. Yes, thank you. So for Nigeria, So for Nigeria, the key providers for vaccination or for immunization services is the National Primary Healthcare Development Agency. They're like the coordinating body for all primary healthcare facilities. So they are like the key they are the key providers, the government recognized providers for vaccination services. And I know vaccination services are also offered in the tertiary facilities, the secondary facilities, and even private hospitals, health institutions, amongst others. And we even have volunteer community outreaches that target hard to reach areas. And the interventions are typically always classified as either the routine immunization or the supplementary immunization activity. So the supplementary immunization activities, like where we have like the novel oral polio NOPV vaccine, which is presently ongoing in some parts of the country, like the COVID-19 is an SIA, the supplementary immunization activity. So typically, it's the National Primary Healthcare Development Agency. They are, the responsible agency of government that, are directly in charge of vaccination in the country. Thank you.
Thank you. From Dr. Ezieni, in public, sorry, you are in the regulator for the region for Africa. Maybe from
this one out.
Sorry?
I'm going to sit this one out.
Yes, I was going to, yeah, I wanted to thank you about that. I wanted to speak to Dr. Jamila Reese. She's a regulator. And when it comes to where you get this, how does the regulation affect the access from your perspective? And then we'll hear from the country stories, what is happening and who provides vaccines and how it is controlled. Thank you.
Thank you, Jocelyn. Thank you, and good afternoon or good morning to all the panelists here. I'll take the opportunity to thank the invitation for this opportunity. Well, just to clarify, at this moment, I'm not working as a regulator anymore. I was previously a regulator CEO at the National Regulatory Agency in Cape Verde. And at this moment, I am responsible, I am the executive director for the FPLP countries. That means the Portuguese-speaking countries. And in this perspective, I should mention all the AFPLP African countries. That includes Angola, Cape Verde, Guinea-Bissau, Mozambique, São Tomé and Príncipe. And the challenge here is that we have the same language, but health indicators are very different, so the priorities are different, and the vaccination coverage is also different. But I can agree with our colleague from Kenya, I think, Lucas, that said that for adults, it's still worse than for children. Because for the vaccination, the coverage for children, as it's usually assumed by the health minister, and is part of the mandatory visitation, medical visitation, it's usually done, and the African countries, usually mothers take care of the children's health in there, and they ensure usually that the vaccination is fulfilled. But there is a lot of differences. We can, as an example, we have good rates from neonatal tetanus, from 70 in Angola, for example, 99 in São Tomé and Príncipe. But then if we're talking about measles, it's only 41 in Angola, and but it goes until 86% in Cape Verde. So I'm here talking on behalf of very different realities and different priorities. So also the regulatory framework also impacts differently in these countries. We know for sure that there is still inequity accessing the vaccines in the rural area, for people that are not so educated. So education, awareness campaigns, and there is a huge effort to be done for the language to be built to really involve people that are not so educated in terms of health literacy. As for the regulation, I think in these countries that I know, I would not say that the regulatory framework is a barrier itself. It would be more the way that it is put in place. But I don't know if I was clear, but I be at your disposal for any clarification.
Thank you very much. I think you're quite clear because of the differences in the different countries, and you actually have different outcomes for the different indicators because of the political will or the priorities in the different countries. Thank you very much for that clarification. Dr. Swalami, you can, I can give you the platform.
Yeah, thank you very much. Good morning and good afternoon, everyone. So this is
welcome.
Thank you. This is Radwan Swalmi, the chairperson of the International Public Relations from the Algerian Pharmaceutical Federation. So I'd like to thank you for this opportunity and this great panel. Well, just to give maybe my inputs related to the Algerian experience for the vaccination. COVID situation, it was a great learning for us, where we tried to contribute as a pharmacist in order to increase the vaccination rate. And as a healthcare professional, we were discussing with the governments in order to try to advocate and make pharmacists as a point of care where where patients can get their vaccination, and few countries around the world who are allowing the pharmacists to do the vaccination. So it was very challenging, but in the end, we convinced the Minister of Health in order to allow the vaccination to in the community pharmacy. But after, I think we are after 8 months that after the authorization from Minister of Health, when we are doing our assessment, we thought that as a healthcare professional, and we were fighting to get the vaccination at the community pharmacy. And today we are a little bit surprised about the results, because in the end, unfortunately, the number of patients who are getting to the pharmacy in order to get vaccination is very low. So maybe this is due to the COVID and all the uncertainty that the patients the uncertainty related to the safety and efficacy of the COVID vaccination. So we don't know if it's one of the reason or we were claiming as a pharmacist that we can play a key role, but when now we have this opportunity, unfortunately we are not contributing strongly to increase the rate of vaccination. And I think today it's our role as in our organization is not only to request and ask to get, for example, the vaccination in the community pharmacy, but we need to prepare from strategic perspective, from education perspective, because unfortunately in some countries like mine, the community pharmacy is more, the practice is more commercial rather than having this pharmaceutical care, and we need, I think there is a really big work to do in order to bring the pharmacist at a higher level, and when it comes to providing pharmaceutical care within vaccination, for instance, not only for COVID but for the rest, because this is where we need to get in order to fight and do more vaccination at the community pharmacies. But we need absolutely to the discussion would be how we bring the pharmacist at this level in terms of education, in terms of awareness, commitment, and so on and so forth.
Oh, thank you very much. That was an interesting presentation, whereby the pharmacists during the COVID, they were actually allowed to vaccinate, but we don't really know the reasons why there are few people going there. And I think that would be a discussion for another day. When you talk about vaccine has a hesitancy or hesitance from the patient or from the pharmacists themselves for whatever reasons. So I think that would be a discussion for another day. In other countries which might have had a legislative or regulatory change or wish to improve access of vaccination from the community pharmacies. You can unmute.
Sorry about that.
Okay.
I'm here, Lucas, Dr. Nyabera from Kenya. So two things, maybe two or three things. The first thing is I'm going back to why pharmacy is the most accessible healthcare personnel, bar none, because everybody goes to the pharmacy because you don't have to book an appointment, you don't have to pay to go there, you just walk in and say what you have. Yet, when it comes to things like vaccines and other things, we don't seem to have the grasp of the public or the policymakers or the politicians. I attribute this to all of them not quite understanding the value the pharmacist can bring to healthcare. And the reason why they don't understand the value the pharmacist can bring to the healthcare is because we are very modest and we hardly say what we can do. Neither do we actually sometimes believe that we can make such a big impact. So when you talk about people not coming, they'll come and show you their warts, but they don't want to come to you to do immunizations. Why is that? Because public service awareness, education as to how much we can contribute to healthcare, and let the policymakers know how much money they can save if they allow us to do it. The other reason why pharmacists are not getting, which I assume also is the cultural and the historical fact that nurses are the ones who used to give immunizations to kids and not adults. So you will find that they would go always all the kids used to be taken. Mom takes you to the clinic and you get your shot there. So now it's for adults. 1, 2, do I really need to have it? The kids have to have it so that they can survive. I mean, infant mortality was very visible. When you're older, who cares? The mentality is not, the patient doesn't seem to understand the importance of it. And that's why I'm thinking education again. If the patient understands why they need to do it, then half the battle is done.
Thank you. So we've had the Kenya perspective, but in Kenya, are the pharmacists allowed to administer the vaccines or any vaccines? Because this was we're talking about access from various institutions. How about from the community pharmacies in Kenya? Maybe just in a word, yes or no?
It's complicated. It's complicated. So you find some places where they will, some places they won't. So it's complicated. It's not clear yet. And that's why I was going back to saying policymakers and politicians need to understand our value, what value we can bring, so that they can give us the tools to be able to contribute to healthcare.
Thank you. Any other countries who can share their experiences with that as community pharmacies?
Well, let me speak a little from Nigeria.
Dr. Adekola from Nigeria?
Yeah.
You can go ahead.
Thank you. Yes, I think I differ a little from the last speaker, but one, I say we are not saying what we're doing as pharmacists. I don't think that is the decision with us in Nigeria. We speak so much, we do a lot of advocacy, we write, we do a lot of work, because the way the EXEC is constituted right now, you know that our friends, our colleagues, the medics, I mean, before everyone.
Sorry, can't hear you.
Can you hear me? Okay. It's a major challenge that we have because policies are done around them to exclude the pharmacist. And that's a major issue. That's where we should drive at to see as much as possible. I want to thank God for the COVID, who has given us a little opportunity in Nigeria, but we have also fought so hard and tough at this last 3 years to challenge the status quo, which is one of the reasons why only in December, pharmacists community pharmacists were given the opportunity to come into vaccination for the COVID. But we're saying it's not just for COVID, there are other immunization services, vaccination services. I'm looking at is the need for us to have a deliberate push on policy and not leaving it to the individual country, but whatever we could do at the regional level to push either through WHO, CDC, and every other organ, that the people in this region, in this continent, can get to see the benefit value the pharmacists to the health of the citizenry, if out. So this will be my contribution. Thank you.
Okay, thank you. We're tight for time, so we need to be any short one where someone, if they have access, another country might have a different perspective or challenges of access from the community pharmacies before going to the next issue. Okay. Thank you. Maybe at this stage, I can ask Dr. Gus to just take over and continue with some of the questions we have for our panelists.
Thank you very much, Jocelyn. I appreciate that. And what we're learning is there's a wide variety of challenges in this region, and it becomes a challenge for us to assess, I guess, what the needs are, the awareness is, and how pharmacy and regulators can respond to that. So I'd like to pose a question to the panel, and I'll identify someone to lead the conversation. So I'll put you on the edge of your seat, but also encourage you to raise your hand if you want to participate as well, because I think it's important that you know your region better than I do, and have those people participate in the answers rather than me trying to select somebody. So what are the regulatory frameworks in your particular area, or maybe in the region, and enabling strategies that have been successful in supporting the role of the pharmacist in providing vaccination, but also providing that source of truth, if you will, about vaccination and the information that people need to be aware of in order to encourage them to get vaccinated. So I'm going to, I know Jamila was a regulator and no longer in that area, but you must have some experience generally in the region as to what are the enabling strategies or regulatory frameworks that could be in place or that are needed in the region to assist with pharmacists being a lead in vaccinations. Jamila, would you be able to answer that for us?
Yes, thank you for the question. For the region, for the Portuguese-speaking country, the issue is that pharmacists are not directly involved in the administration of vaccines yet. Of course, the legal framework does not predict that just yet, but for all the countries, the situation is there is not enough pharmacists. So the issue is not about the pharmacists and the legal framework, but the discussion does not exist yet because there is not enough pharmacists. There is not available workforce. So, for instance, WHO recommends a ratio of 1 pharmacist for 2,000 population. And if we see Angola is 30 times less, or then in Guinea-Bissau is even 50 times less than this. I know it's just an overall recommendation. So the issue here is that we must first increase our workforce, increase not only to have more pharmacists available, but then to train the one that already exists, specialize them, and then we'll have the conditions to do the advocacy to change the legal framework. At this time, for all the 5 African countries speaking Portuguese, there are not enough pharmacists to do this advocacy, to involve pharmacists in the administration. They are involved in the logistic, in all the preparation, and then in pharmacovigilance for the following immunization, but not on the administration. Thank you.
Thank you so much. And I see Pratifa, you'd have your hand up. Would you help us answer that question, please? And you just have to open your mic.
Okay. Yes. Yeah. In as much as I would also agree with Jamila in that we do have limited numbers of pharmacy personnel covering the population. But what has happened, I think this is the pharmacy personnel is not only limited to pharmacy personnel, it's all healthcare workers, which we are facing shortages amongst. And when we do have even the nurses in short supply, the doctors in short supply, it means vaccination coverage is just going to suffer. So what's needed is maybe for the regions to actually also embrace task sharing and role overplay, which is what is needed for, say, for the Zimbabwean pharmacists. Currently, what is happening is the regulation is not specific to say it prohibits the pharmacists from administering vaccines, but it's how the health workers have interpreted that. So medical doctors and nurses do believe that administration of medicines is their turf, and they then are not very welcoming or accommodative when the pharmacist comes in and says, no, they can provide, they can actually help in administering some of these vaccines. Because if we talk about administering an oral polio vaccine, there isn't, it's not that specialized. It can be done. If it's going to be a subcutaneous or an intramuscular injection, yes, we might need a bit of training, but those are competencies which a health professional can acquire. But what is happening now, I think, is there's need for advocacy amongst the health professionals so that they understand that roles can be shared and tasks can be shared, so that especially when we note that in Africa we have a big challenge with vaccination coverage in the adults. And we know adults do not visit primary health care facilities per se, but they'll rather go to a pharmacy than to a clinic. You find that is common in most adolescents and in most elderly people. So you find if we are able to catch them in the pharmacies, we should be able to get the vaccination rates up. But it's a case of advocacy amongst the healthcare workers.
Thank you very much, and make a good point. And I have two more speakers that want to join in, and I think that's just great. But you make a great point in looking at what the legislation, the laws, the regulations actually say. And that sometimes it's very surprising when you look at it with a different set of eyes. Maybe you look at it with the pharmacist set of eyes. Do those regulations actually prohibit, or can they be used to enable that greater access? And once that's seen, then we make certain that the healthcare professions have the knowledge, skills, and ability to do that practice safely. Dr. Adekola, you want to join in, please?
Yeah, thank you. Let me also quickly align my thought with the last speaker from Kenya. Zimbabwe. I think strongly that, just as said, the issue of the number of pharmacists, I don't think that's a problem. It's not a issue because we don't have enough pharmacists. We don't have enough tech providers as well. But inclusion, getting everybody involved, and that is the central issue. And getting, and like we talk about regulatory, of course, there is no law that prohibits the administration of injection by pharmacists in Nigeria as we speak. But just like they said that the people, our colleagues, our friends and colleagues, the physician and the nurses believe that it is their prerogative, it is their primary responsibility to administer. And therefore, when pharmacists coming in, the CEO we're coming to their. This is, of course, I'm happy that at FIP level, at the CPS level of FIP, the new missions for CP that has been launched from 2020 to 2025 speak to the administrations of medicine by pharmacists. And I think it's a good time for us at FIP level, at regional level, to put this. And if we can get this done, I am a protagonist of the fact that there's a need to get to this is done is to control WHO, who is also giving us the policies on task. I think WHO also to promote this. The priorities of the pharmacy in that covers primary care, I think will go away. I thank you very much.
Thank you, Dr. Adekola. And Your audio was breaking up a bit, but I think we caught most of your message, and we appreciate that. And now I'll turn to Dr. Nyang. Thank you for joining us today. And please take a moment to participate in this question with regard to the enablers of a regulatory framework to allow that greater access in your region. Ameth Nyang, you're on mute. If you want to join in, please do. Okay, maybe we come back to you. I'll give you one more opportunity, Dr. Nyang. Yes, you're off.
Merci
Please.
beaucoup.
Yeah.
Enfin, je suis avec vous. Hein.
Yeah.
C'était pas évident puisque il m'avait été envoyé un lien par lequel j'interviens en tant que participant, mais pas en tant que panéliste. Je pense que ça a dû être corrigé par l'intervention de notre frère Prosper, docteur Prosper, que je salue très vivement, pour s'être vraiment investi, pour nous permettre effectivement de partager une plateforme d'échange avec vous, ainsi que le docteur Didier Moulon. Vraiment, je salue cette initiative qui intervient, qui a un moment assez important dans la vie de l'officine, et surtout par rapport au profil du pharmacien. Je pense qu'il est important que les structures, bien les institutions, les structures ou bien des associations qui revêtent un caractère un peu statutaire et puis d'une dimension un peu internationale puissent peser par leur influence pour permettre aux pharmaciens quand même de jouer pleinement leur mission. Par rapport en fait à la campagne de vaccination, je pense que comme tout le monde vient de le préciser, le Sénégal également n'est pas en reste par rapport quand même à la stratégie vaccinale et tout ce qui peut permettre de faire face à la pandémie. Mais ce qui se pose d'un réel problème qui aujourd'hui constitue une préoccupation des pharmaciens, c'est leur implication dans les stratégies, leur implication dans la campagne de vaccination. Et je pense que c'est important et il va falloir quand même aller plus loin si je pense que la FIP peut faire quelque chose dans ce sens-là pour pouvoir quand même interpeller les autorités étatiques, les autorités, les décideurs, pour que, en fait, que ces dernières se rendent compte de l'importance du pharmacien dans le système. Si nous prenons un pays comme le Sénégal, qui compte pratiquement 1200 pharmaciens, avec une géolocalisation qui renseigne sur la position du pharmacien au niveau du territoire national. Parce que partout où l'on va, on trouve un pharmacien. Je pense que les autorités ont beaucoup plus intérêt à s'appuyer sur des professionnels de cette dimension pour pouvoir quand même atteindre les populations les plus éloignées. Je ne peux pas comprendre aujourd'hui que des officines de pharmacie, avec tout le potentiel qu'ils ont en termes de réception, en termes d'accueil, en termes de sensibilisation, et qu'aujourd'hui, ces derniers sont laissés en rade par rapport à un système, par rapport à une stratégie qui concerne, qui vise les populations et qui leur permet quand même d'être préservés par rapport à des pandémies, par rapport à des maladies. Donc, on l'a posé. Je pense que ça a été une recommandation lors du forum pour que les officines de pharmacie soient enrôlés dans le système afin de leur permettre quand même d'intervenir et de pouvoir participer de manière efficace et de manière efficiente à la campagne de vaccination. Ne serait-ce que du point de vue de la rassurance, les pharmaciens, le simple fait d'accepter, le fait également d'intégrer, le fait de prendre en compte tout ce système constitue une assurance auprès des populations. Donc, il va falloir quand même s'appuyer sur cela pour le faire. Parce qu'un système est un tout. Il faut s'appuyer du niveau de compétence de l'ensemble des acteurs du système de santé pour pouvoir quand même en arriver à des résultats concrets. Les officines de pharmacie, on ne cesse d'en parler. Je ne sais pas par quel moyen, par quelle stratégie nous pouvons quand même parvenir à faire comprendre cela à l'autorité. Dans certains pays où le pharmacien migre vers un autre statut de profil, un pharmacien clinicien, un pharmacien qui intervient maintenant dans l'observance thérapeutique, un pharmacien qui intervient, qui participe de manière efficace dans les campagnes de vaccination et autres. Donc, il ne faut pas que notre continent quand même demeure en reste par rapport quand même à l'évolution des missions du pharmacien. Je pense que aussi la FIP doit pouvoir s'investir et puis vraiment créer, je ne sais pas, c'est un texte créé, je ne sais pas par quel moyen elle doit pouvoir quand même peser pour que ces pharmaciens-là soient enrôlés et impliqués, associés à tout ce qui se rapporte quand même, à tout ce qui concerne la vie politique d'une nation. On a posé le problème au niveau de l'UOMOA également, lors des ateliers où il est question de discuter des questions de droit par rapport au droit d'établissement et la libre circulation. Donc, on l'a posé également au niveau de l'UOPA, on l'a posé au niveau également du forum. Partout où on est présent, nous sentons le besoin et la nécessité d'avoir les pharmaciens dans le système de santé. Maintenant, ça dépend du bon vouloir des décideurs. Et je me demande en quoi peut constituer en fait un blocage ou bien une réticence à devoir quand même les impliquer davantage. Donc au Sénégal, c'est là où nous nous trouvons. La campagne se déroule. Les pharmaciens, malgré en fait toutes ces insuffisances et ces manquements, n'ont pas manqué de jouer leur partition pour quand même mieux sensibiliser les populations, pour mieux en fait les rassurer et pour en fait avoir été les premiers à se faire vacciner. Et je pense que ça aussi, c'est quelque chose, c'est un élément très important. Donc, je pense qu'il va falloir consolider davantage ces acquis-là et essayer de les atteindre au point de pouvoir satisfaire le mieux. L'autre élément pour lequel vraiment je tenais à... c'est quand un système évolue, il faut nécessairement que en fait, ces professionnels puissent se mettre en phase. Il y a donc en fait un besoin de mise à jour. Donc, à travers des formations continues, à travers également des données qui pourront permettre aux pharmaciens d'être au diapason de l'évolution du secteur au niveau international. Et aujourd'hui, de ce point de vue, je pense que la vaccination, certes, en fait, une revendication constitue également une préoccupation majeure, mais il est important aussi de doter ces pharmaciens-là de capacité à pouvoir faire face quand même à une telle stratégie, puisque l'environnement doit être approprié, tout ce qui se rapporte également à la sécurité du patient, tout ce qui se rapporte également à la sauvegarde également des déchets biologiques. Donc, tout ceci constitue en fait des éléments qui doivent quand même attirer l'attention de l'autorité, attirer l'attention des responsables des structures de la profession. Et ensemble, dans une démarche synergique, je pense qu'on peut parvenir à réaliser beaucoup de choses. Je pense que de ce point de vue également, le continent africain doit faire des efforts énormes pour que le profil du pharmacien puisse évoluer et ne pas quand même tout le temps le confiner dans une pratique qui est connue de tout le monde. Délivrer des médicaments, c'est limité à tout cela. Je pense que le pharmacien peut aller plus loin que cela. Il a toutes les compétences requises pour pouvoir effectivement participer de manière correcte même, à toute politique de santé en direction des populations.
Very helpful. Thank you. Merci, monsieur. I just want to move on to other panelists with regards to some of the questions that we have. Be more than happy to come back to you, but I just want to slide the discussion over, if I might, to one about switching from the needs of a pandemic to that of endemic response. So we have put in place, or in some areas, there's put in place where pharmacists can assist in the community with vaccination.
La question s'adresse à moi ou bien c'est...
Excusez-moi? No, I was moving on. It's for the panelists. But we want everyone to participate. So thank you so much. But the idea of being moving from a pandemic to an endemic, and I'm wondering if I want to look for a raised hand, but I would also say maybe Enzine, would you have some experience from your jurisdiction with regards to the movement from pandemic to endemic? Although I see you may have been temporarily disconnected. So Dr. Sulanami, did you have some experience with that, where the pharmacists will be the source?
Hi,
Oh, and Zine, there you are. Please go ahead. Can you help us with this?
So I'm just saying that generally during the pandemic, there's rollout with speed and skill, and everyone is, there is, in terms of vaccination and the role the pharmacists play, there is speed and that skill of response that we all partake in. And that's mainly a lot for pharmacists realistically in supply chain. And you see a lot of us engaged in that supply chain response in the community pharmacy as well. There's a whole lot of roles we play in the community pharmacy in terms of giving information, acting as that risk community RCC in the community pharmacy as well. And that's then during the pandemic, and that's really doing that with a lot of, speed, and we're doing that big time. But now that it seems we're heading towards an endemic response, things sort of slow down a bit, but we do not stop. There is still that engagement, but with residual activity, and the focus now is more of increasing the coverage of vaccination. So it's not just that firebrand trying to get a hold on of things, trying to slow down, but now we're now looking at, okay, let's broaden out and increase the coverage of vaccination. So we play key roles during the pandemic, definitely. Procurement, supply chain are part of the things we hold on to during the pandemic. But as we tend towards the endemic response, we still continue to address cold chain issues, improve data for proper forecasting to reduce expiry, which is very important right now because from the angle I am, that's becoming a problem. Expiries, wastages, monitoring IAFI, counseling, it's becoming an issue. So now that we're moving towards an endemic response, it is important that we continue to play those roles as pharmacists in an endemic response. So that's a bit of what I'm going to say about that. And so over to other panelists to see what they have to say about that. Over.
Great points. Thank you so much for raising those points. I think part of what I'm hearing from your response and the response of others is how do we move this to the next steps, and what type of assistance in the African region might FIP be able to provide with regards to increasing the level of vaccination, increasing awareness of vaccination, increasing the access points to include pharmacists. And I'm going to turn to the panelists very briefly, but I want to get to the point about how FIP can assist in creating pharmacy-based vaccination program and overall pandemic and endemic response in this region. And who are the government and regulatory bodies that would be key to implement a pharmacy-based services. Before we move to the panel, I just want to remind you of some of the activities of FIP that are in this area already. And FIP, by providing resources to support the change at a country level through their publications in this area. And they range from FIP, WHO, Good Pharmacy Practice Guidelines to advocacy tools, global data, guidelines, and practice support tools. One example of these tools is a regulatory self-evaluation assessment tool for advancing pharmacy services in the area of pharmacy vaccination, pharmacist prescribing, vaccination administration, and even doing testing. And I'll ask one of my colleagues at FIP to put the link into the chat for the FIP self-evaluation tool. FIP also organizes digital events and webinars regularly to highlight different topics related to vaccinations and share best practices and innovations and the role of the pharmacist can play to improve access to vaccination. FIP also advocates at the WHO for the role that pharmacists can play to facilitate vaccination services and improve the vaccination uptake across the life course. And most certainly over the last 2 years, the highly acclaimed Transforming Vaccination program out of FIP, which focused on supporting FIP members in accelerating programs of equity, and equity is so important, access and sustainability of vaccination through policy development. And through my colleagues at FIP in the chat line, they will put a link to these dedicated services to improve vaccinations. But I want to go back to our panelists, and I think awareness is one of the key things about improving vaccinations, but also there's probably other areas that you can speak about with regards to improving vaccinations in the region. And I'll pause for a moment for someone who might want to speak up. I see Dr. Adukala wants to lead this conversation, and please open your mic and respond.
Thank you very much, moderator. I think this is a very important question in this dialogue. Sincerely yours, I believe FIP could do much for us in the region. First and foremost, FIP has to leverage on its relationship with WHO, which is one body that is very important in the health sector, particularly in a country like ours, and I also believe in other countries. I know there's a document I have which speaks to the legal framework of community pharmacists developed by the WHO region some years ago. Speaking to the roles of community pharmacists in primary area, I think that's where to start. I will want to say that if FIP get WHO to get the same legal framework to be launched across, in the region, first and foremost, that will go a long way. Secondly, I also know in 2019, we were at Ankara, where the Ankara Declaration, at the order of the 2018 declaration Astana was signed, which was led to what we also took. I took Nigeria to get community pharmacists in Nigeria to sign the declarations on commitment to primary. We did this in 2020, December 1st.
Oh, okay, thanks.
Samuel,
maybe just take off your visual and we'll just go with the microphone, and that might help.
Okay, you can hear me very well?
Yes, much improved, Messi.
Oh, okay. So what I was saying is that there's a need for, we look forward to a regional conference of FIP in the African region, where we could also, FIP will lead all African countries to sign a declaration of community pharmacists' commitment to primary care services, and one important among them is vaccination. So if we have these two events, I believe it's going to go a long way to assist the region in getting the issue of vaccination to the benefit of our people in the region. Thank you.
Thank you, Dr. Kalikali. I appreciate your response. Now, I did say that I was going to turn to Dr. Suleimani with regards to our question earlier, but I'm also wondering if you might be able to help us with some thoughts on how FIP can work with the region to help position pharmacists to be that greater access point. And then I'll move on to Nzeen, please.
Yeah, thank you very much. I think, again, based on our small experience, we were thinking that the most important thing is really to focus on the advocating with the governments from the policy perspective. But I think through this experience, we need absolutely to prepare tools and a framework, starting from policy to the awareness to the practice, where we provide to pharmacists. Also, we need to prepare them, we need to educate them, we need to train them, and so we need to give them the right tools in order to be prepared beyond the advocacy that we can do with the government. So because even FIP, and I think we all in our organization, we focus first to advocate with the governments, we're neglecting the practical part. And here I think what we would like to put on the table and what we are seeking from FIP is to prepare or work on the recommendation to pharmacists, like the guideline. It was done, I mean, the guideline, but how we can reinforce that from the like awareness perspective, from the educational perspective, because there is some pharmacists, there is a fear. They don't want to do this the vaccination, because they think that is something that can be is complex, that in the end there will be some effects on the patients. There will be patients will die, and then they will have a responsibility on that. So how to educate, how to work with the pharmacist in order to make them more confident and help, I think, from FIP perspective, how we can support member organizations in order to give them the tools and try to make sure that when the governments will allow us to have this vaccination, then how to make sure that the implementation from the pharmacist, there will be an engagement, a commitment from them from different perspectives.
Thank you, Dr. Sami. I appreciate your comments and thoughts on this question. And as a former regulator, I can tell you, when we deal with enhancing the confidence of the practitioner, it also enhances the competence of the practitioner as well. Excellent point. Izan, I'm sorry if I don't pronounce your name correctly. You're next, please.
It's all right. It's all right. So just a couple of things that will echo what the fellow before me just said. Before COVID, not a lot of countries were allowing pharmacists in Africa to vaccinate. And that has changed a bit in some countries, following the need for pharmacists and the need of saying, recently I just read that South Africa pharmacists have vaccinated over 6 million people. And that shows that there is a need, clear need, and we can feel that need. But the thing is, first, policy. There is something called the African Medicine Regulatory Harmonization, and that has tried to, the body has tried to harmonize regulatory, I think the regulators here know about it, to harmonize regulatory authorities and regulation of medicines across the continent. And that's what the African Medicine Agency is taking over right now. And if we can have something like that in the area of vaccination for pharmacists, that will be very helpful. And it starts with policy, because if there isn't any policy, it's going to be difficult for people to be bold enough to do that. And after policy comes training, because you can have the policy, but if I'm not skilled enough to do that, I wouldn't do it. You could see what's happening in Nigeria. I don't know why people aren't coming to the pharmacy, maybe because they don't feel the pharmacists have the skills, or they don't trust the skills of the pharmacists. It could be a lot of different reasons, but that could be one of the reasons, that they don't feel that pharmacists aren't trained enough to give vaccinations. It could be one of the reasons. So policies is important, if they could help with policy. And then also training is very important, right from the university days, that there's a standardized vaccine-related training, not just the theoretical vaccine, all of that, but also the practical aspects of vaccinations and supply chain, the whole thing all around vaccination, and actually giving the vaccines themselves. It will be very helpful if FIP can do that for members and member organizations, starting with policy and then standardized trainings for member organizations. And that's leveraging this new thing with renewed thing with WHO is a great starting point for them to leverage to get a lot of things done. And I think they can also leverage other organizations as well to get things done, starting with what they've done with WHO. Over.
Great comments. Thank you so much. And I think what I'm hearing on this is there's the three areas of the training and education of the pharmacist. And we have some questions in the Q&A about developing some curricula and what curricula might already be out in place in the African region, but also issues of supply chain and having those vaccines getting to the pharmacists and then in the pharmacies, and then getting into the arms of the patients that need it the most. And finally, the regulatory assessment to whether those vaccinations in the point of care at the pharmacy is allowed. Dr. Niang, s'il vous plaît, just keep your comments en peu. So, we're just shortly running out of time. We want to close shortly. Merci.
Si vous me permettez, je voudrais rebondir par rapport à ces préoccupations qui sont soulevées, dont la première me semble être vraiment d'une importance capitale. C'est l'influence de la FIP, la Fédération internationale des pharmaciens, auprès des autorités politiques, pour pouvoir quand même permettre aux pharmaciens de se déployer dans le cadre de ces missions de santé publique. Je pense que, je l'ai dit l'autre jour, les associations, ou bien les structures que nous créons au nom des organisations professionnelles doivent avoir en fait des statuts juridiques auprès des institutions internationales. En Afrique, je pense que l'OAS, la Commission santé de l'UEMOA, l'Organisation mondiale de la santé, je pense qu'aujourd'hui, c'est en arrivant à faire de telle sorte que la FIP puisse quand même intervenir à temps réel et se sentir impliquée dans les politiques de santé pour pouvoir jouer la médiation entre ces institutions ou bien ces organisations internationales et les pharmaciens. Je pense qu'il est important. Aujourd'hui, je ne peux pas comprendre la conférence internationale des ordres francophones pharmaciens qui aujourd'hui, en fait, je ne peux pas dire n'a de nom que par rapport peut-être à son existence, mais que doit être son impact dans la vie du pharmacien, que doit être son impact également dans le système de santé. Je pense qu'également, il y a lieu de réfléchir dans ce sens-là. Et une fois que cela est fait, donc, des recommandations et des résolutions pourront être appliquées par les autorités politiques, tout en leur faisant comprendre la nécessité vraiment d'inclure et d'associer le pharmacien. Je voudrais également rebondir sur un fait qui est assez important et qui constitue un blocage réel, le statut de l'officine de pharmacie. En réalité, les autorités sont tout à fait sceptiques à l'idée de permettre aux pharmaciens d'intervenir parce que le cadre n'est pas souvent approprié selon la vision qu'ils ont de l'officine. Il va falloir réviser le statut sur le plan juridique de l'officine pour essayer de trouver les moyens d'en faire un établissement de santé publique. Je pense que tant que cela n'est pas fait également aussi, il y aura de la réticence et il y aura également des blocages pour permettre aux pharmaciens d'intervenir de manière responsable. L'autre élément, vous l'avez bien souligné.
Thank you so much. I
le
appreciate
profilage des
your help.
pharmaciens.
Just very quickly, please.
Oui, vous me suivez?
Yes, please. Just one final point.
Le
Because we're running
profilage
out
du
of time.
pharmacien. Non, il faut qu'on aille vers les besoins de formation sont là. Il faut que le pharmacien soit également évolué en fonction de ce qui se fait par rapport au système de santé. La campagne de vaccination. Aujourd'hui, les officines de pharmacie doivent être dotées d'un potentiel qui devront leur permettre quand même de participer à la campagne de vaccination. Les pharmaciens également doivent être formés et que des mises à jour doivent être faites.
Yes.
Donc, par là où je termine, donc, ce sont les deux autres éléments qui constituent l'éducation et la sensibilisation. Il n'y a pas en fait un cadre beaucoup plus approprié que celui de l'officine de la pharmacie.
So we have
le pharmacien est suffisamment outillé pour pouvoir sensibiliser, convaincre. Parce que le niveau de fréquentation des pharmacies, s'il fallait faire l'évaluation par rapport aux autres structures de santé, je pense que quand même, il y a un équilibre réel.
We appreciate that very much. And also to
le
have the
premier
impact
accès,
with people that are making the political decisions and then making the labeling legislation. We have just a few minutes left. We could spend hours talking about this subject. Obviously, a lot of passion, a lot of interest, a lot of desire, and ultimately we're here to meet the needs of the public, and that's how we can move on. So I will turn that back over to Jocelyn, my colleague and co-moderator, for some closing comments and to end this excellent presentation on behalf of FIP. Thank you so much.
Thank you, Dr. Goose. This has been a very lively meeting and a lively presentations from different countries with different perspectives. It is the vision of FIP to try and develop pharmacy under the one FIP concept. Because when we are talking about this, we want all pharmacists to be able to provide services different in their different areas, irrespective of which country you are from. We want pharmacists to improve the pharmaceutical care in those countries. And from the discussions here, I think the issues which have come out very clearly is the need for the regulatory environment to improve, to acknowledge the role of the pharmacist and the pharmacists themselves to do their part through advocacy and through education, through their educational systems, so that we have a pharmacist who is able to provide the various services we are talking about. And in this same breath, FIP has tried as much as they can to come up with webinars which have been necessitated or have been in response to requests from the member organizations and from the members themselves, so that they are empowered to do what they are supposed to do to provide pharmaceutical care. And in this instance, we're talking about vaccination. As my co-moderator has actually alluded to earlier on, there's been transformation in vaccination webinars, which have been running on our FIP website. And even prior to that, during FIP conferences, I remember the FIP conference in Argentina and the FIP conference in the UK, which was in Scotland, I think. There was seminars where people were actually trained physically to actually do the administration of vaccines. This is all the efforts of FIP, and this can be go down to our countries so that we are able to do what is expected of us. But I think the one of the most important things is for us as pharmacists to do our part and to be part of the game, to be part of the profession. One FIP, one for all pharmacists is the division of FIP. Thank you. I want to appreciate all those who have attended this webinar, and thank you for your time. We've run over by about 3 minutes, but thank you very much to our presenters and to all those who are here who have contributed in this thing.